Dear students, welcome to the Medical Genetics course. By the end of this video, you are expected to illustrate multidisciplinary approach in organizing prenatal diagnosis, identify guidelines and strategies for prenatal diagnosis, understand indications for prenatal diagnosis, and classify genetic tests used in prenatal diagnosis. Indication of prenatal diagnosis. We have couples known to have identified risk of genetic disease and couples that are not known to have any risk for genetic diseases. Approximately 3 to 5% of pregnancies are complicated by birth defect or genetic disorders. Chromosomal abnormalities are present in approximately 1 in 150 live births. Congenital malformations remain the leading cause of infantile death and the leading cause of childhood death. The most common indication in prenatal diagnosis are couples known to identify risk of genetic diseases. If they're carrying a chromosomal abnormalities, or carrying a genetic mutations, or having a previous child or pregnancy with genetic disorders. The second indication of prenatal diagnosis in couples not known to identify the risk of genetic disease, but they undergo to prenatal screening with a high risk of aneuploidy or having a high serum markers or having a warning signs in antenatal ultrasounds. Prenatal diagnosis need a multidisciplinary approach. Maternal fetal medicine specialists meet with geneticists, NICU and PICU physicians and nurses. Sometimes other pediatric subspecialties are involved, depending on the case. These multidisciplinary meetings happened once a week to discuss complex cases, to provide the optimal fetal management. In prenatal testing, we use a wide variety of screening and diagnostic tests to assess health of a fetus. First trimester prenatal screening. A combined test with an ultrasound measurement of nuchal translucency and a screening of the maternal serum of PAP-A and the free beta-HCG. This combined first trimester screening test can identify a pregnancy with increased chance of aneuploidy, such as Down syndrome and Edwards syndrome. There are 3 important rules in first trimester prenatal screening: taking history, first trimester ultrasound, maternal serum screening test. In taking history, identifying the maternal age. In women older than 35, there is an increased risk of chromosomal disorders. Taking detailed history is essential. Asking about a previous pregnancy with malformations or genetic disorders, or if there is a family history of genetic diseases, malformation, intellectual disabilities, or handicap. Taking a detailed history about the maternal diseases is essential. Some maternal diseases is associated with increased risk of birth defect, such as diabetes and phenylketonuria. Don't forget about maternal exposure to teratogenic agents in their work or life. The second rule of first trimester prenatal screening is the ultrasound test to measure nuchal translucency. Ultrasound is a gold standard technique, a non-invasive tool used by obstetricians to assess fetus situation in utero. Using ultrasound to measure the amount of fluid in the skin at the back of the baby's neck is taken. This is called nuchal translucency. All babies at the stage of pregnancy have fluid at the back of their neck, but babies with Down syndrome or Edwards syndrome tend to have more fluid. The third rule of first trimester prenatal screening is maternal serum screening test. We measure 2 placental hormones, the free beta-HCG and the PAP-A. And prenatal testing. There's 2 options, invasive and non-invasive tests. The non-invasive prenatal testing, NIPT, a screening test to determine the risk of the fetus if it has a certain genetic condition. It requires drawing blood only from the pregnant woman to analyze circulating fetal cells and maternal blood sample. With this technique, we have 0 fetal risk. In invasive prenatal testing, we have 2 major techniques. First of them, the trophoblast biopsy. Chorionic villus sampling is a part of prenatal testing, in which a sample of the chorionic villi is removed from the placenta. The sample can be taken from the cervix or the abdominal wall, trans-abdominal ultrasound-guided technique. The second invasive prenatal testing is the amniocentesis. In amniocentesis, doctors take a sample of the amniotic fluid. The sample is removed through a fine needle inserted into the uterus through the abdomen, underlying an ultrasound guidance. Genetic testing for the sample depends on the genetic anomalies. It could be chromosomal or specific mutation in genetic disease. Our rule of prenatal diagnosis is to detect fetal anomalies prenatally, to estimate the prognosis and the severity of the fetal condition, to provide treatment for fetus in utero, and to organize medical interruption of pregnancy if needed. Also provide genetic counseling with the families, discussing the risk, benefits, and the uncertainty of genetic diseases. Geneticists provide genetic counseling to explore family concerns, provide risk assessment for either family member, and to provide psychological support and follow-up. Here is some references for who's interested to read more. At the end of this video, we have talked about multidisciplinary approach in organizing prenatal diagnosis, guidelines and strategies for prenatal diagnosis, indication of prenatal diagnosis, genetic tests used in prenatal diagnosis.